Good afternoon and welcome. I'm Nancy Hopko, a member of the Board of Directors of the League of Women Voters of Central Delaware County. And on behalf of the League, I thank you for joining us today for our second Health Topics in a series on health-related issues. As many of you know, prior to COVID, the Hot Topics programs were luncheons with guest speakers. We've been amazed and delighted by the very positive response in having these programs on Zoom. As of yesterday, 25 people had registered for this program, and the recording will be available on our website. The League of Women Voters is a nonpartisan civic organization committed to promoting political responsibility through informed and active participation in government, citizenship, and elections. Our motto is making democracy work, and we do that through registering people to vote, organizing and presenting candidate forums, providing candidate information through vote411.org, and holding educational programs on various issues of concern. Many of our programs this spring through June are related to some aspect of health. Upcoming, the next program, I think, is the live February 21 in-person lunch and discussion with Delaware County Council and other county government officials at 12 noon at the Springfield Country Club. Details are on the website and in the voter. I have some housekeeping details before I introduce our speaker. All participants except our speaker, the moderator, and our tech wizard, Kathy Youngman, will be muted. The questions submitted prior to today have been shared with our speaker. Additional questions may be submitted during the presentation using the chat function. And I thank you for joining us. Now it's my pleasure to introduce our fellow League member, Rosemarie. Rosemarie Halt has nearly 40 years experience as a healthcare professional working in advocacy and government affairs. As a registered pharmacist with a degree in public health, she has focused her career on nonprofit and public health systems. She chaired the COVID task force for Delaware County and was the COVID liaison between Delaware County and the Chester County Health Department. And subsequently, as the Chester County Health Department was approved and developed, she served as interim director. She continues to serve us as chair of the Delaware County Board of Health. And having shepherded Delaware County through the process, she consults for other counties seeking to establish public health departments, as well as NGOs such as Children First. From 2014 to 2020, Rosemarie was Senior Director of Policy for the Maternity Care Coalition. Her background in pharmacology positions her perfectly to advocate for mitigation of such public health crises as opioid addiction and today's topic, lead toxicity. We're delighted that today she's presenting on the crisis in lead poisoning on behalf of Children First. Thank you, Rosemarie.
Sure. Thank you. Thanks everybody for having me today. Delighted to be back with the League. And, always love the Hot Topic luncheons. And this is a great way to continue them. Especially, I'll put my COVID hat, as we've gone through this winter season, respiratory viruses and COVID have been increasing. So I applaud you for keeping everyone as safe as possible and doing Zoom when you can. So today, if we could, and we'll just pull up the slides if we can. Yeah, we just got to play from the start. Thanks. And we can go to the next slide. And so just wanted, as was pointed out, I'm representing Children's First today. And Children's First is a nonprofit in representing children across Pennsylvania in a wide variety of issues around education, health, and other concerns, including behavioral health. So I'm happy to be working with them so closely on several advocacy issues, including lead prevention in Pennsylvania. And next slide. So real briefly, today's agenda, just wanted to be able to go through lead paint poisoning, that it's what the problem is in Delaware County and some things in the state, highlighting that lead poisoning is an environmental justice issue, that we need to test older homes, and that we're going to look at blood tests for all children twice by ages 1 and 2, and then provide you some resources and advocacy points. So what's happening? The Delaware County Lead Prevention Coalition was founded in 2019, and to bring together municipal leaders, housing code enforcement staff, landlords, lead remediation and lead dust inspectors, companies, and just a general array of different people from all facets of life in Delaware County. And we're all focused on reducing the devastating effects of lead poisoning. Next slide. So the impact of lead poisoning. So why does lead matter? So when a child or an adult ingests lead, it can cause permanent neurological damage to the individuals, particularly in children whose neurological systems are developing. It can have severe impact that lasts the rest of their life. The other thing about lead is that lead, once it's in your system, it causes the damage, and the damage it causes can't be reversed. Now, there is, in extremely high lead levels, there is a process called chelation therapy that they can do for children. But that is not, that only gets the lead out that's in the blood. And it's usually very high levels that they would do this therapy for. And it still won't reverse the effects of what happened to the child while the lead was in their body. And sometimes it's a long time before the child's actually diagnosed. Could be ingesting the lead for years. So understanding that it's lead poisoning can cause learning disabilities, increased need for special education services because of the developmental delays. It can trigger aggressive behavior in children. Sometimes that is the thing that actually gets the child tested for lead, because while it's usually toddlers and younger children, some children are diagnosed at 4, and they just have issues in preschool and aggressive behavior, attention deficit disorder, ADHD. Those spectrums are also linked to lead poisoning. Can significantly decrease a child's IQ and future learning potential and ability to go to school and be successful. It can cause hearing loss, speech delays, and it is also, with the combination of all these things, a possible risk factor for criminal behavior. It's interesting. There's some studies that have linked incarceration and previous exposure to lead. And, so it's something that as we go through today, we mentioned it's an environmental justice issue. It's a justice issue in general because of the impact on certain neighborhoods more than others. Okay, next slide. So on average right now, and so I'm going to speak a little bit more about the data, but nearly 300 Delaware County children are poisoned every year. Delaware County is the 5th highest number of children poisoned in all PA counties. Enough children are poisoned to fill 14 preschool classrooms, to just give you a visual. And with only 21% of the children actually screened in the county for lead, we think that that number would be much higher. This is just the children we know about. And there, in January of 2022, a new state blood level was established by the Pennsylvania Department of Health. And it changed from 5 micrograms per deciliter to 3.5 micrograms per deciliter, which the Pennsylvania Department of Health is already anticipating significantly increased number in the children that will test positive for lead this year. Unfortunately, because of the processing of data through the data systems in the Pennsylvania Department of Health, there is almost a 2-year data lag in us actually getting updated information. So we won't know for sure. We've asked them to give us like hints of what's happening, but we won't actually have the actual facts of the change in from the 5.0 to 3.5, how that's going to significantly increase the numbers. But we heard estimates increasing the number of children that would then be considered lead poisoned increased by 40 to 50%. So we anticipate a lot more children. If we often got this question, so we created a slide on it, but comparison to Flint, Michigan, Delaware County, our children are poisoned at the same rate as children poisoned in Flint, Michigan at the peak of the city's water crisis in 2014. And the city of Chester had 4 times as many poisoned children as compared to Flint, Michigan. So, as we going through, I think it's really important to think through these factors while, the news may highlight other areas in the country, these things are happening right here in our backyard. Next slide. So we want to test all babies at 1 and 2 ideally. And both the CDC and the American Academy of Pediatrics recommend the universal blood lead testing for children living in the communities with more than 20% of the housing built before 1950. Delaware County meets this criteria. So most of the, and we'll talk a little bit more about this, most of the properties in Delaware County, 80% of them were built before 1979 when lead was banned in paint. So there's a really high risk for most of the properties. One of the communities, and I'll talk a little bit about what we're doing with municipalities, one of the communities, East Lansdowne, that just passed an ordinance that we helped them design, 90% of the homes in East Lansdowne were built before 1979. So at H1, why do we focus on H1 and 2? Because peeling and chipping paint is a major source for children getting exposed. But most people kind of have this image of the child, and we have this video, like picture here of the child kind of eating the thing or putting in their mouth, but it's actually the lead dust that gets most children. And so, and it's the friction on the windowsills, opening and closing doorways, baseboards being hit by toys or vacuum cleaners and things that create the dust. The child is on their hands and knees at that age. They put their hands to their mouth, and then that's how they usually get a large amount of lead in their body. So private insurance. So last year we did have Senate Bill 522 was passed in the Pennsylvania legislature. Unfortunately, and a little illegally, I may say, because they broke their own House rules in the amendments. But on the very last day that the bill could be passed last year, they a group of Republican members altered the bill and watered it down. And so in the bill, we had that every child in Pennsylvania would be tested at 1 and 2 for lead. And they changed it, the bill, to say that back to the CDC guideline, saying that that's, which Pennsylvania was already doing, that was the requirement. Now, children on Medicaid and under Medicaid federal rules, every child on Medicaid is supposed to be tested. But even in that group, only 40% of the children are getting tested, even though it's part of the law. So what we want is every child tested, make this a thing. You go to the pediatrician's office and they can write the order. I apologize for coughing. They can write the order and send you to the lab, which is not the most ideal, or do a capillary test in the office, or have a point of care machine to do the testing. So yes, we want every child tested, and the insurance companies, as the one golden part of the Senate Bill 522 was that it did require all insurance companies to pay for the lead test. And so there's no exceptions for that. So, most children are covered under Medicaid, CHIP, or private insurance in Pennsylvania. So, if we just follow the basic rules, we can have children tested and more children detected before they have the adverse consequences. Okay, next slide. So as it said, 80% of the Delaware County homes were built before 1979. We need to test older homes for lead paint hazards. While screening is really important, getting the lead out of homes is even more important. We want to prevent the child from even getting sick to begin with. So, the number one place that children get it is through paint. There are other sources, obviously, as we mentioned, the Flint, Michigan, lead pipes, lead toys, lead in like ceramics and certain other types of dishes and things that kids can be eating off of. But when generally in Delaware County, it's still lead paint as the number one source. And then, children under 6, particularly kids under 3, are the greatest risk, as we said, but pregnant women also can be exposed to lead. And obviously that's a developmental issue. And so we want to make sure that pregnant women are also getting tested. So we did have that as part of the legislation. That part was also taken out. Senator Baker, who sponsored the bill, is planning to amend to offer the amendments this year. So that is definitely an area where we could use the League of Women Voters' help in supporting that amendment. And once I have the new bill number and it's been circulating, please ask your representative to co-sponsor the memo so that we can ensure that the bill that we've been working on for years actually gets passed in the way that protects children in Pennsylvania. Okay. Next slide. So as I mentioned earlier, lead poisoning is an environmental justice issue. In Delaware County, 5.5 times more children who are Black and Hispanic are poisoned than white children. And oftentimes, and you'll see some of the slides, that disproportionate because they are more likely to live in older communities with deteriorated lead-based paint. And oftentimes there's a link between lead ingestion, and also one of the things that we recommend families is to making sure that your child has proper nutrition. So that if they don't have proper nutrition, the lead has a more severe effect on the body just because they're already, maybe having issues. For example, if they're not, calcium and different irons and things that combine lead are things that we would recommend for children to be making sure they're getting enough of in their diet. So that's where like the WIC offices and places are also another places that we recommend people to get children enrolled there, because they do regular testing. So trying to increase understanding of that in these communities and making sure that children are getting all the resources that they need to be healthy. Next one. So childhood lead poisoning is preventable. And the prevention starts with removing lead paint hazards in the home. Now, this is an extreme example of a lead remediated home. And oftentimes we focus on the inside of the house, but in some instances in the lead remediation, when there's so much peeling and chipping paint that dust is, you're walking into the house and you're carrying that dust now into the house, or the child's playing on the side of the house. So the remediation may mean doing things on the outside. There's 2 types of remediation. It's called lead safe and lead free. Lead safe makes the home pick the areas that, so when they go in to do the testing, they have this little machine that kind of scans and can gives you the amount of lead in different surfaces or places in the home. And so ideally, it's all those surfaces that I was talking about: windows, doors, woodwork. So that's in lead safe, you are remediating most of those types of things. Lead free is you're taking every source of lead away from the home. Obviously lead safe, the average cost for that for an average home is around $12,000. If you get into full lead remediation, making it lead free, that can be, anywhere from $50,000 to $100,000. So the goal is to really promote the lead safe, because that's where 90% of the lead poisoning is occurring, is on those surfaces. And, while ideally we'd love to make every home, lead free, that is not something as a goal that's realistic if we're going to have, the ability to protect every child. And we'll talk about in Delaware County in a minute about the services that are available. But when you do lead free, Sometimes that is necessary with a child with very, very high lead levels. So for example, there has been in my work, not necessarily in Delaware County, but in other counties, but there has been very high levels in Delaware County as well. There was a child with a blood level of 55. That entire home was made lead free. That there was just so much lead in the home, and they just that child's blood lead levels were so high they wouldn't even do the chelation therapy on that child until the house was made lead free, because it would have been a waste of time and cause undue pain and suffering kind of to the child to do that chelation therapy twice. So it's good. It's really interesting to see these houses being done, and there's a lot of work being done in Delaware County. And right now, good news is last year, through the Pennsylvania Lead Free Coalition, we had another big win besides getting the Senate Bill 522 passed. We got the legislature to spend $10 million on a new law passed to get more kids tested and more houses remediated. So that money has just been released, and Delaware County received, in addition to its HUD money that they received from the federal government, another $150,000 to remediate homes in Delaware County. So, good things are happening, but long way to go. Next one. So as we were highlighting, lead poisoning is still a significant public health problem, and just giving you like a baseline of where we are. As I mentioned, we're the fifth highest number of lead poisoning in the state, with about 80% of the houses were built before 1979. 19% of the children, 19 to 20% of the children are tested, and then our rates of poisoning is about the same as other areas, 2 to 3 times. And then number of children poisoned, and this data actually is 2020 data, so it was 249 in 2020. I'll show you some updated data that I got from the health department. Next slide. So in the fall of last year, Children's First and the Pennsylvania Lead Free Coalition had a forum in Delaware County, and at that forum we unveiled our action plan to prevent childhood lead poisoning in Delaware County by 2027. This action plan was stimulated also by the formation of the Delaware County Health Department. So now that we had the health department, we had a means to make some of these needed changes actually work. And it reinforces the need of why we needed the health department. And this is one of the first things that we could really see the impact on. So next slide. So in that action plan, the first thing that was identified was remove lead paint hazards in homes, as I was talking about. There are hotspot municipalities, and I'll show you some information on that shortly. And so we're working on those to change their existing ordinances to ensure rental properties are lead safe, and enact new ordinances requiring rental properties and homes up for sale to be tested for lead. Big deal. We're modeling this after Philadelphia and Norristown's codes that they changed. We got East Lansdowne to change it in December, so they updated. They were the first one, and the city of Chester is going to be our second one, and that announcement is coming out pretty soon. Hopefully either at the end of February or the beginning of March, the city of Chester will be making that announcement. Ideally, we would want the state to change their building code so that we don't have to go to each individual municipality and have them change their building codes. But right now that's not feasible. It'll probably take us years to do that in Pennsylvania. So we're working with the municipalities that have the highest rates of lead poisoning in Delaware County. And this is again something that the league could help with, in really encouraging municipalities to do that. Especially, we're looking in areas of the Springfield, Media, Swarthmore all have older homes, and those would be a good place to start. They also are areas of the large rental housing, and we want to make sure that families are kept safe. It's very difficult for families who are renting properties to even raise the issue of lead poisoning. If they do have a child, oftentimes the landlords can be resistant to doing that remediation, but they are also eligible, landlords are also eligible for HUD funding, as well as individual homeowners. So, we're trying to help them understand that we can help you increase the value of your properties if you allow this remediation to go forth in your building. And then we do a lot of education around what I was just speaking about, and then creating a county policy to allow tenants to withhold rent if their landlords fail to fix a lead-related housing code violation. So that is something that we're going to be trying to advocate for as well with county council. Next slide. Ensure all children are tested for lead and improve their health outcomes. So we're partnering with healthcare providers and parents to problem solve barriers to testing children at ages 1 and 2. For example, oftentimes one of the biggest barriers is that the parents can't get to, get the child tested because they have to go to a lab quest or LabCorp, and they can't. Their work schedules or their kids' school schedules makes it difficult. Plus, oftentimes the children, getting a venous blood draw from a child is not a fun experience. And so depending on the child, and so if they have other children in the house, sometimes they're reluctant to do that. And then the other thing is that it's getting it done. Oftentimes they might get it done at 1, but then they don't get it done at age 2. Pediatricians' offices are overwhelmed and understaffed, and they're often struggling just to do the basic care. So having them take 5 minutes to do a blood level in the office is sometimes just impractical and not possible given the current situation that they're facing post-COVID. So we're trying to work with different providers and helping them through these hurdles and provide education. We're also making sure that the child is referred to early intervention services as soon as possible. So the good news is that the Delaware County Health Department, through working with them with Children's First, we helped them coordinate how the information would get to early intervention services. There's a clear, streamlined approach now. So the case manager for the lead at the health department, has a process of notifying early intervention services and the HUD office in Delaware County, so that the child is immediately has that warm handoff instead of, telling the parent, oh, and here's the number to call. So we want that warm handoff, that they're getting in touch with somebody right away. And then Medicaid health plans collectively fund a staff member at the health department to coordinate case management. So both Medicaid plans in Delaware County are interested in this. And so we're helping to coordinate that, and hopefully that comes to fruition in the next year. Next slide. So communicate effectively with county stakeholders about lead poisoning, which is what I'm doing today. And then also implementing culturally relevant communications. And I think this is really critically important in our communities in Delaware County. We have very diverse communities, and too often, the information obviously is in English and Spanish, but for example, Upper Darby High School has 80 different languages spoken. And, communicating with families that are already living in some of the, many of them are renting their properties, many of them are in older properties, and not being aware of the lead issues just because of the language barrier is something we really have to work on in Delaware County. And then train serving organizations of the risk factors, health and housing strategies, and other resources. Next slide. And then step 4 is to secure sustainable funding for lead prevention. At the federal level, we're working to secure $1.5 million annually to support future federal lead remediation grants. We're working to secure $1 million annually for lead poisoning prevention. That is going to be dependent on the Governor Shapiro's budget. So we're interested to see how much he's going to put in for lead in his new budget. We're looking for another $1 million annually for private funding from foundations, corporations, health plans, and county health systems to really build up sustainable funding. I can give a great example, and I would love if we had a health system in Delaware County to do that, but we all know that that's not a reality. But in Lancaster, Lancaster General and through Penn Medicine has pledged $40 million over the next 10 years to remediate homes because they had so many children testing positive for lead. And so that is a huge commitment by a health system to really look at something that they felt was a major issue in their community. Wouldn't that be nice if we had somebody like that? And then working with coalition partners to create permanent lead testing and remediation fund for families with low income and moderate incomes. While the HUD funding is pretty generous in its income determination, there's many families that fall through the cracks because they could be $1,000, over or whatever. And it's really difficult for some families, to put $20,000 to remediating their house when they have young children. So we're really working on a fund that helps all families get remediated. Next slide. I'm not going to do this now, but you guys will be getting the slide deck. But we had two parents who were at the lead forum give testimony, and we recorded it. And these are the two YouTube videos, and they're really powerful. One mother is a grandmother, and she was homeless and taking care of her grandchildren, finally got into a house, and the house had lead. So some stories that really hit home why it's important that every house is tested and every child is tested. And I think they're powerful. So if you get a moment, look at those. Next slide. So as we mentioned earlier, the Delaware County Health Department, having them on board was really critical to making this action plan work. So these are the things that the health department is working on. So we're increased communication with the Office of Housing and Community Development. They're working with the Community Action League of Delaware County, working with the WIC program, and working with local housing and code officials on education. They come with me actually to many of my meetings with the local authorities. And then they're working with nonprofit foundations, health professionals, landlords, and parents, all of which to help increase what the coalition is doing. And they've been a great partner. Next slide. So they're working on maternal and child health team monitors, and their team is and case managers are monitoring the blood level, as I said, the 3.5 micrograms per deciliter, and really looking at children under the age of 16 living in Delaware County, and increasing the information that goes out through the schools to make sure everyone is getting tested. And then their epidemiology team is really doing a great job evaluating surveillance data. I mean, the health department, just as a reminder, is going to be a year old in April. So they have a lot, they're really getting their epi team and their case managers working. But it's the fact that this is going to be built in at the ground level is really critical for making this program work long term. Okay, and they do have a link to some of their surveillance reports. Next slide. So as I mentioned, that number for blood lead levels, the one number we had was 2020. There's 294 in 2021. But again, recognizing that it wasn't until last year that the new blood level came out. So we anticipate that this number going out. And again, that we're only testing about 20% of the children. Okay, next slide. So this is a map, and in this map, it's the average blood level in the children from 0 to 15 that was greater than 3.5 by census tract. So you can see some of the communities, particularly around Upper Darby. We call these our hotspot communities, where there's aging housing, a lot of rental properties, and that's where we're seeing the higher blood lead levels and higher number of cases. As you can see in different parts of the county, like Edgemont, Middletown, where there's newer houses, that's a lot less level. But that doesn't mean that there's not lead poisoning in these communities. It also may mean because of the Pennsylvania law or the Pennsylvania regulations that and guidance for physicians says that they ask the question, is your house older than was built before 1950? And the question should be really, was your house built before 1979? And then the other question is really, does your child have time in other people's homes? So as I mentioned, the grandmother was taking care of her grandkids, and the grandkids spent most of the time with the grandmother, and she was the one with the lead in the house. The parents did not have lead in their house. So there's lots of factors that go into a child testing positive. Next slide. So in this one, we're looking at housing units by year built in the census tracts in Delaware County. So this is really interesting, and it highlights where we're seeing, again, the higher number of cases are really in these red and purple areas on the map. And then the green areas towards the western part of the county are housing stock that is a lot younger. So in targeting resources, when you have limited resources, the health department is really looking at, do we have to target more education and more outreach in these communities? So that really helps us, gives us a picture, in how we use our resources, and many times they're still limited. So how do we have the most bang for our buck? It's certainly not saying we're not paying attention to the rest of the county, but these are where the concentrated areas are that we have to focus on. So that's another great thing of having the health department. Next slide. So as we said, we want to test older homes. Here's some information, a parent resource toolkit that you can share and learn more about it. And this is all on you can also type in the Lead-Free Promise Project, and it has resources and toolkits and all kinds of advocacy information on that website for the entire state. So you can click on each county and it'll give you the data for that county, as well as giving you some other background about that individual county's issues. Next slide. So we also have lead information sheets like this up on our website for Delaware County's efforts in child prevention, for child lead prevention. Sorry, I've been talking a lot today. So there is, we have this great flyer that's available, and these are the phone numbers to refer somebody that has lead, that is interested in lead paint remediation. And these are the Delaware County programs. So there's two of them. One is the Delaware County Office of Housing and Community Development, and the other is the Community Action Agency. The Delaware County Office of Housing and Community Development does have, is the official HUD designee for the county. And so they have a lot more money to give out. However, the Community Action Agency is not as restricted in money as far as the specific income levels. So that's a good resource for families that may exceed the income levels for the HUD program. The other thing with those, and that's fine, those flyers, as I said, are available, but as we said, we only have it in Spanish. My goal is to get these in multiple different languages, but we have to find the funding for that. So anybody has ideas for that, let me know. Next slide. So this is an example of some of the information that we give lawmakers. This is also available on that PA Lead-Free Promise Project. We have ones for each county, as I said, but these right here, it's just an example of what kind of like, we're giving the lawmakers and what our action steps are statewide. So we've just begun doing some advocacy now that the House is sort of getting together. So we'll be increasing that advocacy, and every legislature in Pennsylvania will have a copy of this. We also developed a resource guide for care management of a child with elevated blood levels, and it has a lot of good information for practitioners, for and also people that work with families, as well as families themselves. It has, what to do if your child is lead poisoned, and besides, getting the paint out of your house, it has some other resources for you to work with practitioners on how to get the child help for like early intervention. Next slide. So these are just some contact information. The Delaware County Health Department the Delaware County Lead Poisoning Prevention Coalition, and the PA Lead Free Promise Project. Next slide. These are Delaware County private lead testing companies. So if you did want to have your house tested, this is where you can contact. These are, just examples of lead testing, but these are the ones that have been on the list for quite some time. So I feel fairly comfortable recommending them. But this is just a sample of those operating in Delaware County. Next slide. So we're asking a call to action. We want to sign up to help kids join the Delaware County Lead Coalition. This says fill out the card on your table, but we don't have that. So you can always contact me, and we'll be more than happy to connect you. The coalition meets monthly. And as I said earlier, the Delaware County Coalition, has a variety of different people from different walks of life being involved. And so everybody's skill set is welcome. Next slide. And that's it. Yay. Sorry, I've been coughing. Sorry. So, Nancy, were you talking?
Thank you. Okay, so taking it from the top. Thank you. And Rosemarie needs to be out of here promptly at 1 for another meeting. So I have a couple, most of the questions that were sent in beforehand, she addressed it in the body of her content. But we have a couple questions that were submitted during. Here's one. How would tenants know that remediation is needed? And would landlords be required to reveal test results to tenants?
That's a good question. That's part of what we want to do with the municipality code changes. And so it would mandate that ideally in the municipalities that every rental property is tested before to make sure that it's at least lead safe, and that every home at sale was tested, just like the radon testing I equate it to. So that you would get a report saying that the house, had this lead level, but currently that is not the case. So it would be up to the individual to request that as part of their inspection, for example. So you'd have to ask for that. And most people don't know enough to ask it. And we were on at the beginning when we lived in a 120-year-old Victorian in Media when we first got married. And it was very romantic. We were fixing it up, but we had 3 young children. And if I'd known what I know now, I would definitely do things a lot differently going in there. And then we eventually found out that the house had lead paint, it had lead pipes. It would have been good for us to know that before we started doing all the work and having the children there. My daughter, oldest daughter at the time, had a slightly elevated blood lead level. And that kind of triggered us looking at everything. But fortunately, she didn't have any long-term consequences from that. But it is frightening. And it's something, people just aren't, aware of enough to even ask for.
Mm-hmm. Thank you. So you indicated that we have private vendors that people can call directly to get their house evaluated, but is there an office in Delaware County that people could contact for testing, or is there free testing available?
Yeah. So if your child or grandchild tests positive, then the Delaware County Office of Housing and Urban Development would come out and do the testing. And that would be free. But other than that, if there's no free general testing, although if your house is eligible, so you don't have to have a positive child to get your house remediated. Okay, so if you have, if you think you're at risk, and ideally we don't want the kids poisoned, we want them to prevent it. So if you're in an older home or other types of living like a condo or something, and you think that there might be lead there, you could ask them to test, and they may test for you from the Office of Housing and Urban Development. And you may be eligible for some remediation to make your house lead safe.
Okay. Another question just came in. You indicated that the law will mandate testing at 1 and 2 years of age. The question has to do with the benefits of testing older children, 5, 6, 7, etc.
Yeah, so what they have found, particularly for lead paint poisoning, is that it's children under 6 are the most at risk. One is because, as I explained, they're like crawling and they're more likely to put things in their mouth. Older children can be at risk for lead poisoning, so you would have to look for some of the, you might be looking for some of the symptoms for them, and some of that might be like the aggressive behavior, ADHD. They would be things that you may want to request the pediatrician to do a lead level, when they're doing some of the other work on the child. But generally, we don't, unless there's reason to believe. So, for example, we did have a case in Pennsylvania. So this family, the younger child tested positive for lead, and that child's older siblings also tested positive for lead. So, generally, if a child in a house tests positive, they may test all the other children in that house.
Mm-hmm. Makes sense. You indicated that people can get tested through their provider's office, pediatrician, general practice, but is there lead testing at the county directly?
So the exciting news was that, and I helped break the grant, so it's even better, so Delaware County got funding from the federal government, and through Congresswoman Scanlon's office, that we received $1.75 million for Delaware County Health Department to work on health equity issues, including lead. And so this is going to fund their mobile unit, and they're going to be purchasing point of care lead testing machines as part of that mobile unit. And the mobile unit will be going around to health fairs and different things like that, and being able to do a variety of screenings and testings, including lead. But it's, remember, the health department just got started. So this is something they're working towards. Other than that, at the health department, the WIC office in Delaware County also does lead, has a point of care testing machine, as well as the Federally Qualified Health Center of Chest Pen.
Okay, we have a question about the great amount of money that President Biden just announced is coming into our state to deal with lead. What will the Department of Health be overseeing that? What's going to happen with our lead pipes?
So most of that money was targeted for Philadelphia, but there is, and we're trying to find out, is the money going to go to other older communities in Pennsylvania? But it's an example of what the federal government will need to do to really address these issues. Very exciting is I was able to have several families that we've been working with in Delaware County and Philadelphia who actually came to be with President Biden for the announcement, including the person that introduced him. And there's a video, and I can send you a link, was one of the mothers who helped change the ordinance in Philadelphia. And she worked with her community, and it was very grassroots change that happened in Philadelphia. And she, because at the time her 2-year-old daughter got lead poisoning they lived in one of those older communities in Philadelphia that used to be industrialized. And the soil had extreme high levels of lead, and her daughter had a very high level and actually suffered hearing loss and speech issues from her lead poisoning that she will have for the rest of her life. Right. So it was great to have a mom stand up and introduce the president and say, this is, and she helped. And the Philadelphia law is one of the more strict laws, not only in Pennsylvania, but in the country. So she really did a lot to make that happen. So I think, again, lead pipes in some communities are definitely a concern. And I think as more information is coming, we certainly have to change these lead pipes, in all communities. And it's just a very expensive proposition. So, I think it might have to be like a very targeted work between the municipalities and the federal government. But it's certainly exciting that there's work being done on that. It's $500 million is going to the through the state for Philadelphia. But you can imagine all the pipes in Philadelphia that has to be changed. It does have some for lead paint remediation and some money for soil remediation. And that could be statewide. We're still trying to find out the exact amounts. So I don't know the exact amounts yet that might come to Delaware County. But the good thing is, because we have a health department, it can be easily filtered through the health department.
Yes, yes. What's the impact of lead poisoning on adults in Delaware County? The extent?
Yeah.
Mhm.
Yeah. So most of the lead poisoning does happen in children. There are a few cases of lead poisoning in adult, but those cases are oftentimes connected to other sources, like somebody was poisoned from using, I was talking about like bakeware or plates and things that were made using lead. And so that's usually the source for adults, or industrialized areas where there's like lots of lead in the air and things like that. But I asked the health department that actually, and they've inherited the data from the Pennsylvania Department of Health, and so they're still sifting through a lot of data. But to their knowledge, I think it was only like maybe one case in the last few years of a very high lead level in an adult.
Okay. What can you say about the correlation between lead and crime, particularly related to our taking lead out of gasoline 20 years ago?
Yeah, so that was a big change. There is a good report that's on the PA Lead Free Promise Project, specifically on the links with crime, and it was produced by Fight Crime PA, working with the district attorney's offices. And so I refer you to that. I would just say in general, there is definitely not only from, there has been studies about that impact. Of course, when you think of Delaware County, I use this example. So you have the I-95 corridor going through some of the, what I call that area where it's, when you look at the map from the airport all the way up to the city of Chester. And, those are some of the oldest homes we have. It's the industrialized areas we have, and we're running a major highway through there. So, I think that the level of lead exposure in those areas can be tied into, some of that from before the lead was banned from gasoline. But, particularly in the soils and things, which was one of the sources in the woman in Philadelphia when her child was poisoned because of the location near not an industrialized area, but also a highway.
And I think our last question is one that remained unaddressed from the pre-submissions. Are there any industries where workers are particularly at risk for lead poisoning?
Yes, but I'm drawing a blank on exactly what they are, but there are still industry things that lead may not be the primary thing, but it comes out through the process. So like trash removal, like burnings, things like that, or things where caustic substances are used. And so some things have underlying lead in them still. So if you think of like you're burning all the old pottery that's like sitting around, like, so there's sources of that nature. But there are, I think I'd have to look that up, but I don't know for sure. If there are.
Jodine just suggested industrial painting, like painting bridges. Did the paint restrictions cover industrial painting?
Yeah, it was all removed after 1979. But removing, I would also say that removing paint and working in construction areas that have older properties is also another source if they're not properly using vented air mask and things.
Okay, you have time to go to the bathroom before your next meeting.
Yes,
We've gone through our questions, and we are deeply grateful for your time Thank
Sure,
you.
sure. And I'm happy to share any resources. Thank you all. You're all wonderful.
Oh,
Good to
yeah.
see you.
Anything you have, we're happy to receive and post.
Okay, great.
Um,
Yeah.
and before we dismiss, do you have any messages for us?
Any advocacy that you guys can work with the state league, and getting this issue elevated, I think is really important, especially as we're working to get funding and the legislation to keep kids safe.
Thank you. Okay.
Thanks.
El President, do you have anything you want to say to us?
Just that, thank you so much for doing this. This is really informative.
Yes.
Learned a lot. I've been trying to catch up with you. I know I have more work to do, putting the resources over here in the chat, some links. But what we typically do is we'll get the recording link, we'll get some resource links, we'll send it out to all the people that registered. And great. Thanks again. Thanks
Thank
for all
you
your
all.
work.
This
Thank
was
you.
really dense with great information. Thank you so much.
Sure.
Okay, with that,
All right, take care.
we are on to our afternoons. Thank you all for coming.